Dr. Rob here from Westside Family Chiropractic in Peterborough. So one of the first conversations I have with all my low back pain patients is in regards to their sleep position. If you're waking up and you're really sore and you're really stiff in the morning, it's usually due to one of two things. One, the position you're sleeping at night, and two, your mattress. In my experience, sleep position plays a greater role as far as waking up with a stiff and sore low back. So before you go out and buy that new mattress, this video's for you. So the first thing we need to do is, if you're a stomach sleeper, we need to get you off of your stomach. When you lie on your stomach, first of all, your head and neck is turned like so. If you throw a pillow underneath, all of a sudden your head and neck are in this position. If you're sleeping in that position all night, that not only causes stress and tension on your neck, that stress and tension translates right down into the low back area and your pelvis. And that creates a lot of tension and stress on the discs and ligaments in your spine. If you have to sleep on your stomach, try placing a pillow under your pelvis to take some of the strain off your low back. If you're a back sleeper, try placing a pillow under your knees to ease some of the tension on your pelvis and low back. As well, you can try placing a rolled up towel under the small of your back to support your lumbar curve. If you're having a more severe episode of low back pain, try lying on your back with your feet up on a chair. The most common position that people sleep in is usually on their side. Now, a lot of my patients are surprised to learn that it's okay to sleep on your side as long as you keep your spine and your pelvis and your body in a nice neutral position. When you lie on your side, you want your head and neck in a neutral position. That is, you don't want your head tilted to one side or the other. You want your arms out in front of you. You don't want to tuck that lower arm up under your head. You want a slight bend in the knees. Don't bring them up in the fetal position, as this bends the low back forward. Now, you want to pay attention to your pelvis and hips. Notice that Matt's pelvis is square to the bed. What tends to happen though is that your upper leg moves forward. Notice the twist that's happening in his low back and his pelvis. When you spend the night in this twisted posture, it causes all the muscles in the low back and pelvis to tighten up. Is there any surprise that you're waking up stiff and sore in the morning? The key is, just as you're nodding off, mentally check, is my pelvis square with the bed? If you roll over in the night, mentally check, is my pelvis square with the head? This is a tough habit to develop because you're half asleep as you're trying to do it, but keep working at it, keep working at it, and keep working at it. Try placing a pillow between your knees. It may not completely stop you from twisting, but it will help. You may need to experiment with a few different pillows to find the size and shape that works best for you. There's no hard and fast rules, but generally, smaller pillows work better, so start there. You can also buy a special pillow that's designed to go between your knees while you're sleeping. This one here I bought a few years ago, tried it out, had a great night's sleep, told my wife about it, she wanted to use it the next night, and I've never gotten it back since. You can also try a small rolled up towel placed behind your low back. What I find is that this naturally pulls you back onto the towel, which helps keep your top leg from moving forward. My preferred method, however, is to sleep with a body pillow. I tuck it between my knees and then have it run along the front of my body. I find that this works best for me to help keep me in a good sleep position throughout the night. Give these methods a try and find out what works best for you. It may take you a couple months to get into a routine, so keep working at it. The more you stay aware of your body position and your awareness of your pelvis, the easier it will get. If you found this information helpful, please like and share this video with your loved ones. If you have any questions, leave them in the comments below or send me an email and I'll get back to you as soon as I can. Till next time, I'm Dr. Rob. Thank you.